most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to fix rounded shoulders. We're also going to show you how to test to see if you have rounded shoulders. We got 3 tests. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Are we giving away the mattress? Oh, if you want to get a mattress, go to our giveaway section on bobandbrad.com. Like I said, the giveaway section, you can win a Sleepovation mattress, 700 individual mattresses. This is a fantastic mattress if you're having any pains. I think it's the back pain, shoulder pain mattress.
I concur, Bob. I very much concur. Carry on.
So you can also go to Facebook. It'll be pinned to the top of the page, the contest. You go to Twitter, Instagram, or TikTok if you want a 60-second version of our program a day. Plus, we have
podcasts out, and those are outstanding. We've got some wonderful
really
guest
great
speakers.
interviews, yes. And we sometimes just talk by ourselves.
So yeah, sometimes Bob just rambles on all by himself.
All right. So what is the problem with rounded shoulders, Brad?
Well, they're multiple.
Yeah.
You know, it's a postural thing that is not only unsightly visually, at least for most people, but it affects your neck, it affects your breathing, it affects your shoulder mechanics, even your low back. Everything is connected, so it's a multiple problem issue that should be addressed.
Brad and I often will take a patient. That's the only thing we correct is their posture, and their pain goes away.
Yeah, things improve.
So it's nothing to put slight. You got to take it seriously.
Right.
So the other thing is, Brad, you used to teach a class on self-defense.
Mm-hmm.
You want to make sure that you look confident when you're on the streets.
It's true. It's very true, because we don't want to get into that whole thing, but that whole appearance thing,
right?
You know, if you're looking confident with good posture and you go into a job interview, that's the first thing they see, and that's going to make a dramatic impact.
I've hired hundreds of people for physical therapy practice over the years, and it was good posture always won out.
Yeah.
I mean, it was a factor I looked at.
Well, it's one of the, you don't even think about it.
You don't think about it, right. All right, what are the muscles involved in rounded shoulders? So you have some muscles that are tight, and you have some muscles that are stretched out.
Right.
Pectoralis minor, the chest muscles, they're often tight. Which causes a forward head posture. So now these muscles right up here, the neck muscles, the cervical extensors, the ones that are real deep, they get tight. So you have trouble even straightening your neck out like this. Upper and middle trapezius, they get stretched out. Levator scapula gets stretched out. Rhomboids get stretched out. That's enough people need to know.
We're not even addressing the problem with the discs in the spine, which can cause big problems.
Okay, so 3 shoulder tests to tell if your shoulders are rounded. Number 1, I want you to stand with normal posture. Don't try to straighten up if you don't normally stand, straighten up. And I want to see where your palms are and where your thumbs are at. So this, if I'm standing here, is actually pretty good. My palms are facing toward my thighs and my thumbs are forward. If you have rounded up posture, look what happens. The palms face back and the thumbs face towards the thighs.
Right.
We could probably just talk about the palms.
Sure.
Palms are to the side, that's good. Palms to the back, that's bad. All right, now let's go over to the wall here.
It's a great tool to help posture assessment and correction.
Yeah. So I'm putting my pelvis against the wall, and I'm putting my mid back against the wall, and I'm putting my head against the wall.
Right. 3 points of contact.
Now, if I stand here normally, look what happens.
Look at this gap here.
Yeah, gap here.
Gap here. Yep.
So it's something I have to work on continuously, like everybody else. I'm tall. I got a long spine, and I have to work on getting back in this position here. Now, if you can't even get your head back without going like this, you are tight. I mean, there's some loosening up that needs to be done in the upper back. And if you can't get your shoulder blades back, again, things are tight.
Right.
You got to stretch out the pecs. You know, it's a problem.
I've had patients stand up against the wall like this and check, and I'll gently, of course, kind of push here, and they say, "Oh yeah, I feel that stretch here," and that's what they need to feel that when they do their exercises.
So you have to walk around with me, Brad. Push that back while I'm walking around.
Yeah,
Yeah.
that's not going to happen.
Okay, next one. You have to lie on the floor for this. You couldn't lie on a bed or anything like that very easily. But
Oh, yeah.
I'm gonna show on the mat right now because just so you can see. But it's very simple test. All you do is you lie on your back, and you're first gonna check the fibers, the lower fibers of the pec major, and you go like this. Now you can maybe see this or maybe you can't see this, but I have this arm goes all the way down. It's making contact all the way along what would be the floor. On this one, it's actually raised up a little bit. And this is the side I do have trouble with.
Hmm.
And I can't get this elbow on the floor without pushing it down.
Yep.
And at first I couldn't get down to the floor even if I did push it down.
Sure.
So this side is a little bit tighter.
Right.
Now,
And a lot of people will have that. That's
Yes.
not uncommon.
and if you want to check the actual upper fibers of the pectoralis major, you actually just make a cross.
Yep. Straight
It's
out.
the same thing you're looking to see. Are you able to get the arms all the way flush with the floor?
That's right.
So those are the three tests, and I'm assuming a good majority of you aren't going to pass it. I mean,
Well, particularly if you're older, if you're 50 and older, but if you're in your 20s, maybe will. But although the way people spend time on, cell phones and everything that promotes that flex posture, you never know.
okay, Brad's going to show the first one to do, and you're going to take the foam roller.
Yeah, we'll just use this one.
Yeah.
All right. So if you happen to have a foam roller, you need the long one, the 3-foot one. Here, can you take that,
That's
Bob?
the one that actually, this is the OPTB one from, it's called Axis, AXIS.
Yep. They make a nice foam roller. And you're going to lie on it like this, right down your spine. Make sure that your head can touch. And they're typically, I don't know, Bob, do you work on these or are
No,
you
I
too
don't.
tall?
I think I could fit, but it's just not. I do different things.
Yeah. I know, but I didn't know if a 6-foot sick person.
Maybe I should do this one.
Yeah.
I got tight shoulders.
It also, you work a little balance on this is just a benefit, but that's not the
Well,
primary
it's nice
reason.
because it's very simple to do.
Yeah.
I mean,
And it's easy. It's one of those relaxing ones. You don't have to work at. You allow gravity to pull your shoulders back here. You can put your arms out here. Oops. You can go up in this way.
you know what I just saw, Brad? This was actually in a myofascial book. What they did in this position, they actually took hand weights
Oh,
and went
sure.
back for it to
Mhm.
really give a good stretch.
Yep. And then if you cannot get your head down without pain, you may have to put a rolled up
Yeah.
or folded towel here and then make it thinner and thinner as it stretches out.
Yeah,
as you
because
get
there
better.
will be some of you that cannot get your head down because you have too tight of a forward head.
And if you can get it down, the next thing if you want to do some chin tucks while maintaining head contact, that's an option. All right.
Very good. I just realized you have a ball in your
Yeah.
sash.
Well, I like to keep it there just in case I need it.
Well, why don't you grab that one, I'll grab this tennis
right.
ball, and we're going to show the next thing you're going to do. So the muscles back here, believe it or not, can be tight and in a rounded out position.
All right. So there,
Yep.
you got to break that tissue up, and there's
It's
some
very
fascia
tough.
in there.
Collagen,
Yep.
very tough material. It's very hard to break that up,
Yep.
hard to mobilize it. So we actually use a ball. I start with a tennis ball, and you want to hit. I'm going to show the 6 spots, Brad. We've done this
Oh
quite a
yes,
bit.
yes.
So you're going to hit right between. Here's the spine, and here's the shoulder blade. Shoulder blade. You will stay off the spine, stay off the shoulder blade, and you're going to hit this spot, all the way down. So you got 6 spots. 1, 2, 3, 4, 5, 6. And you can just lie on them for maybe 30 seconds. For most of you, when you start this the first time,
Mm-hmm.
when I lie on it like this, now if you do it on a hard floor, which you should do, it's going to be too much. It'll be
Yeah.
too aggressive.
Mm-hmm.
You can start by putting a pillow under your head, and you can also put a towel over the ball. And that'll soften it a bit, and you can try that. And
Yeah. Let's just So there, and you take a folded towel and
Yeah,
put that over the ball.
yeah.
And it makes it a little more comfortable when you first start working on this.
That thing can make a big difference in your posture.
Yep.
You know, I think it's really it's something I would mention on this. I believe it really has a lot of worth.
Right.
And like I said, you could spend 30 seconds on each spot, or you could go up to a minute if you want to.
Sure.
All right, Brad. Why don't we also show the strengthening using the bands?
Oh yeah. The old posture strengthening stand. And this is great for your shoulders. Great for posture. So if you have, the stretch bands that are out there, and you need to have to, anchor it to the wall one way or another. We use the wall anchor because it works so well. It's easy to put on and off for other exercise options. But I'm going to pull my hands towards my chest or my ribs here at this level, and
I'm going to show what
squeeze.
he's doing. He's going like this.
Oh yeah.
He's squeezing his shoulder blades together.
And there's options. You can
also
bring your hands in
You
here,
can go down like this.
down here, out like this. And if you
Yep.
want to work that rotator cuff a little bit,
This
one
is
way or
really
another.
a good strengthening exercise. That's really easy to do. You can just, if you keep an anchor on the wall like this, every time you walk by, you can just grab it and do a few reps of this, because this is something that you do throughout the day.
And you'll feel those muscles back there working, and they just feel like they've tightened up.
You want to grab that band once, Brad, just bring it over here. The band.
The band?
That one. This exercise tubing. Sorry.
Oh, I didn't know if you were talking about ZZ Top or what kind of band.
Yeah. Someone just died from there.
Oh, really?
Yeah.
Oh.
They're bassist, I think.
I used to like them a lot.
So anyway, you can just grab tubing like this and go like this too.
Right.
If you just want to do it at your desk, you can use a band. Use a band or
these
there you go.
These loop bands,
loops work
if you
really
have
well.
those, they work well. I got a black one. I won't be able to see it against my black shirt.
So that's it. You got the rounded shoulders. We got solutions for you. Give it a try and comment below.
Yeah, straighten up is what we're trying to say. Straighten up.
Yeah, get to it.